So it's Saturday. Does that mean that we are not going to do practice questions? No, quite the contrary. We're going to do some anyways. So today we've got a 5-year-old who comes in with a neutropenic fever for our main case. They ended up getting a transplant recently. Um, doesn't particularly matter which type of transplant it is, but we'll say that it's kidneys for the purpose of this. And their fever is nothing crazy, of course, over the 100.4 mark. We'll say it's 101. And they have a whole bunch of anterior cervical lymph nodes that have been growing. It's to the point where they're palpable, noticeable even by the patient and their family. Now, when they had their transplant done, they didn't have any Epstein-Barr virus PCR noted, nor did they have any cytomegalovirus, so HHV5. But at this point, now they do have EBV, but they also have LDH. Okay, so you might want to try and pick between two options between pneumocystis jirovecii for your LDH, or you might be tempted to just pick a phenomenon called post-transplantation lymphoproliferative disorder. Um, and in this particular instance, that is the right answer. Okay, so you're going to have just a whole bunch more B cells coming around than you would have normally. Um, but the main reason why is because they're saying that if they want the answer to be Jirovecii, if they want it to be PCP pneumonia in this instance, they're going to go ahead and give you the symptoms, okay, respiratory failure, um, having low oxygen, and the LDH is definitely high in pneumocystis, and so that's can be a giveaway in some cases. But the lymphadenopathy actually isn't terribly common for these practice questions. All right. So if all you wanted to do was just hear a little story about one of the many things that can go wrong for somebody after a transplant, then you can go ahead and tune off because I'm going to go ahead and switch over to a few other things. All right. So one of the things that I also wanted to talk about is the many, many effects of our buddy, a class 3 antiarrhythmic called amiodarone. Now, amiodarone has a lot of effects, and so sometimes it's hard to keep track of them all. So we are talking about things like making the QT longer. We're talking about hepatitis. We're talking about neuritis, optic neuritis, which is a multiple sclerosis finding, but also corneal microdeposits, which is a little bit more unusual. Blue-gray skin discoloration. The only other thing that we think about with that is the gray baby with chloramphenicol. It doesn't come up too often. And you could also have peripheral neuropathy. Um, Last that I wanted to get on with amiodarone is the very specific finding for a chest X-ray, and that's a bilateral effect that mostly hits on the middle of the lungs on each side. Now, that doesn't really make a ton of sense on the left side because you've only got the two lobes, but right around the middle area of the lungs. All right. And the last one that I wanted to talk about today was managing your aortic dissections. Now, we know that aortic dissection is one of the kind of exceptions to getting blood pressure lowered in a quick way, as opposed to a lot of other things that we more so let the person kind of more appropriately trickle their blood pressure down. But on top of that, you have to be prepared for telling the difference between a type A dissection and a type B dissection. And they make that kind of easier for you because the type A dissection is just quicker, so before the left subclavian, whereas type B is when that extra flap that kind of gets separated in the aorta and lets blood get in there, if it's farther than the left subclavian, then it's a type B. Now, type B is the one that we can play around with and try and medically manage and get them a little bit more stabilized before we decide whether or not we would have to move forward with surgery at some point. Whereas the type A is not something that you're able to wait on. That's something that you really need to get in on the surgery pretty quickly. One last side note that I forgot to mention before about our friend with post-transplant lymphoproliferative disorder is that a solid drug for these people is rituximab for its B cell suppression. So just remember that rituximab can help you with B cell suppression. All right, thanks for listening. See you next time.